Hey everyone, so Minister Cockrill and Andrew will have some opening comments. We'll turn it over to questions. So, Minister, I'll turn it over to you when you're ready.
Thank you. Good afternoon, everyone, and thank you for being here in what is a chilly day here in the province and in Saskatoon. I have some comments I want to make around hospital safety and security, but before I get into those substantive comments, I want to acknowledge a couple of recent incidents at Saskatchewan healthcare facilities. The first incident I want to speak to is an incident that happened in December at Prince Albert Victoria Hospital, where a patient was removed from the facility. I'll let Andrew speak to more of the changes that the SHA made after that incident as a result of discussions with Prince Albert Grand Council. I'll share that I had an opportunity to speak with Grand Chief Brian Hardlott a couple weeks ago about the incident. We had a good opportunity to discuss that incident and how we would continue to work together along with the Saskatchewan Health Authority to ensure, again, that all Saskatchewan residents have an opportunity to be safe and secure at Saskatchewan healthcare facilities. Another incident recently in our province, a couple Fridays ago, happened at Royal University Hospital here in Saskatoon. The young man, Mr. Dubois, unfortunately lost his life that day. I know that I want to start by offering my condolences to the Dubois family. I understand they had a wake and a funeral last week for their much-loved family member. We've had the opportunity, I know, and Andrew will speak to this as well. On the day of the incident, Andrew and several other executives from the Saskatchewan Health Authority had an opportunity to meet with the Dubois family and I think really start a conversation in terms of understanding what occurred that day and what changes can and will be made going forward. Obviously, there's still some information that all parties are waiting for, as I understand, from the Saskatchewan Coroner's Service as well as the Saskatoon Police Service. Obviously, like the family, both the Saskatchewan Health Authority and the Government of Saskatchewan awaits those results and is committed to continued discussion both with the Dubois family directly and as well with the Saskatoon Tribal Council. I've had the opportunity to speak with Tribal Chief Arcand several times in the last week and a half and as recently as yesterday. I know Chief Arcand mentioned at the press conference last week that the family would like to sit down with me at some point, and although we haven't connected yet, I wanted to allow appropriate time for the family to grieve the loss of a loved one. Certainly committed to meeting directly and speaking directly with the Dubois family at a time where we have some more information and so that we can have a more fulsome discussion about the specific incident and the steps being taken going forward. However, I want to turn to what we're here to discuss today, and that is the government's commitment to ensuring that healthcare workers and patients right across the province can be safe when they're receiving care and safe when they're providing care. We have heard concerns from patients and families and healthcare workers about the safety and security of healthcare facilities in different communities around the province. I will share that we are listening to these concerns. We've actually been working for several months in regards to these concerns, and today I'm announcing that the Government of Saskatchewan is ordering an independent review of hospital safety and security across the province. Everyone who walks through the doors of a Saskatchewan healthcare facility deserves to feel safe. Every staff member deserves a safe work environment where they feel protected and supported to provide that patient-first care. But unfortunately, we are seeing increasing frequency and complexity of hospital safety challenges. And while some steps are already underway to address these concerns, we see the need for a more comprehensive system-wide review. The Ministry of Health will lead work to select an independent expert capable of undertaking a review of hospital safety and security across the province, with work to begin as soon as possible on this. This review will take a broad look at hospital protective services, how they operate, how incidents are handled, and how safety can be strengthened while maintaining culturally safe and respectful care environments. The review will focus on several key areas: current protective services standards, best practices and delivery models, opportunities to improve training, tools, and infrastructure, the interfacing of protective services with external security agencies and law enforcement entities in municipalities where we have healthcare facilities, ways to strengthen partnerships with Indigenous organizations and other health system partners, and lessons learned from past incidents to identify system-wide improvements, again, to put patients first. This review is about making sure our safety response evolves to meet the complex needs of patient access, staff, and communities today and into the future. The recommendations of this review will be made public and will guide policy, training, tools, and service delivery to ensure our hospitals remain safe for everyone. I want to emphasize that as we prepare to launch this review, we are taking steps to enhance security right now. And I'll let SHA CEO Andrew Will speak to the actions being taken this week and into the future to strengthen hospital safety and security through the deployment of metal detectors in our urban hospitals and urgent care centers, as well as enhancing security services in 8 additional facilities across the province. I just want to say to the frontline staff who have raised concerns and shared their experiences, your government has heard you, and this review will ensure your perspectives are carefully considered as we work to create a safer environment for everyone, for healthcare workers and for patients. I also want to acknowledge and thank our protective services personnel for the important work that they do every day in our healthcare facilities to work to keep everyone safe. As I started, the government is committed to ensuring that our hospitals and healthcare facilities are safe places to both receive and to provide care. This independent review, as well as the safety actions already underway, will help us move toward that goal as we continue to improve work environments for staff and put patients first right across the province. Thank you, and I'll let Andrew make some comments, and then we'll take questions.
Thank you, Minister Cockrill. My name is Andrew Will, and I'm the CEO of the Saskatchewan Health Authority. Safety is a core value of the SHA, and we are committed to providing a safe and secure environment for patients and healthcare teams in all of our facilities. Like health systems across Canada, the SHA has responded to an increase in violent incidences and weapons entering emergency departments and hospitals. We recognize that hospital safety and security is an issue that is top of mind for patients, families, and communities across Saskatchewan, and it is especially top of mind for the people who work in our hospitals each and every day. Our 45,000 staff and nearly 3,000 physicians are providing care in increasingly complex environments, and we recognize the safety and security challenges that come with that. We know that behind every conversation about hospital safety, there are real experiences, incidents involving threats, assaults, verbal altercations, and situations where weapons enter health facilities. These events are deeply concerning. They are stressful for staff, unsettling for patients and families, and they have no place in healthcare. Violence in healthcare settings is unacceptable. Hospitals should be safe places for everyone, and the SHA is committed to strengthening the safety and security of our hospitals. A key part of that work is the role played by our protective services officers, who support safety every day through prevention, screening, de-escalation, and rapid response, working closely with clinical teams and law enforcement when needed. Across the province, we have over 275 SHA protective services officers, along with additional support provided by third-party protective services providers. These officers receive a minimum of 100 hours of training. I want to acknowledge their professionalism and the essential work that they do, often in very difficult circumstances. We are committed to providing the tools, support, and resources required to respond to the increasing complexity and volume of situations occurring in hospitals. To strengthen hospital safety and security, the SHA has expanded metal detection in urban emergency departments to help prevent weapons from entering into the care environments and to ensure the safety for patients, visitors, staff, and physicians. Following a successful pilot at the shared emergency department entrance at the Royal University Hospital and Jim Pattison Children's Hospital in Saskatoon, the SHA ordered additional metal detectors in December for broader deployment across urban emergency departments. Installation of the metal detectors occurred on Monday, January 19th in Saskatoon at both the St. Paul's Hospital and Saskatoon City Hospital emergency departments, and on Tuesday in Regina at the Regina General Hospital and the Pasqua Hospital emergency departments. Initial reports indicate that metal detectors at these sites have already resulted in weapons being confiscated, and they are also having a deterrent effect. Additional deployment will follow in February at the Prince Albert Victoria Hospital, Battleford's Union Hospital, and also at the Regina Urgent Care Centre. To support implementation and consistent operations, the SHA is adding the equivalent of 51 full-time protective services positions to provide 24/7 staffing for screening and operations. These additional resources will strengthen day-to-day safety and security in our emergency departments, while also ensuring protective services teams have the support they need as metal detection is deployed. Metal detectors are not the only solution, but they are an important one. They provide a consistent screening measure at emergency department entrances. They help prevent weapons from entering care environments, and they support protective services teams to respond safely and effectively. As we look to broader solutions to strengthen hospital safety and security, we welcome the independent external review announced today by the Ministry of Health. We see this review as an opportunity to strengthen hospital safety and security across the entire system, using evidence, best practices, and an objective assessment of our current approach. Recent incidences, and the Minister mentioned two very tragic incidences, are growing in terms of complexity, but also the volume of situations requiring protective services intervention. And that is reinforcing the value of a comprehensive review. We will work closely with the Ministry of Health and fully support the reviewer in examining protective services delivery models, training, tools, infrastructure, and partnerships, including the importance of culturally safe care environments. We take this work seriously because it matters to people. If you are a patient or family member, you should feel safe when you come into a hospital. If you are a nurse, a physician, or a member of the healthcare team, you should feel safe coming to work. And if you are a protective services officer, you should know that you have the tools, training, and full support of the organization to do your job effectively. Today's announcements reflect a clear commitment. Our hospitals must be safe places for patients, families, and teams who provide care. We will continue taking practical steps, working closely with the Ministry of Health to strengthen safety and security across Saskatchewan. Thank you.
Thank you, Minister. Thank you, Andrew. We'll open up for questions here.
You mentioned the two recent incidents off the top. How much did that play a part in today's announcement?
Well, let me just say, as I mentioned in my comments, we've been working on specifically the implementation of metal detectors for several months with the Saskatchewan Health Authority, and because this is something that we've heard directly from healthcare workers right across the province, whether that be at St. Paul's, at RUH, or other facilities, large and small, around the province, but certainly more concentrated in our larger urban centers. The metal detector piece has been working on for several months. Obviously, it's taken time to procure the equipment and make sure that that the Saskatchewan Health Authority can staff up appropriately to make sure that equipment is being staffed. The piece around the review, though, I'll just say, I think it's incumbent on us to ensure that, whether you're a healthcare worker or a patient entering a facility, that you feel safe. Andrew mentioned, the significant complement of protective services officers that we have within the Saskatchewan Health Authority, not to mention the third-party providers that we have in other facilities. And I think both with what we've heard from healthcare workers and with some of the recent incidents, it's an opportunity to take a step back and say, let's look at the larger picture here. Not just a specific incident or two specific incidents, but let's step back, take a larger look at things, and really ensure that both staff and patients, that we have the appropriate level of resources, that we have the appropriate structure in place, and again, that those providers have the right training and tools to keep you and I and our friends safe when we go as a patient, but more importantly, even the healthcare workers who are providing that care, that they feel safe each and every single day.
How long are you expecting this review to take? Do you have a defined sort of timeline, or is that yet to be sorted out?
That's yet to be sorted out. My preference is it needs to be a comprehensive and fulsome review, but yet I know there's urgency around this, right? I mean, we have patients going into facilities every single day. The metal detectors, I think, that Andrew mentioned at the facilities in our urban centers, it's a good step forward. But I think I'd like it to be relatively quick so that we can, come up with some proposals and some plans and then start to implement that again so that patients and staff can really trust that what the work of our protective services members are doing in hospitals and that patients and staff feel safe.
Can you talk about what the metal detectors look like in the process for patients now when they enter the emergency department, and if it's going to affect patient flow or time or anything like that?
Yeah, I'll just say it'll be important to us to ensure that we do have effective flow as patients are coming into the hospital. That is one of the reasons that we've added additional staffing to support the process as patients come in. The experience will be similar to coming into an airport to travel. You'll be able to empty any metal items that you have, go through the metal detectors, and then carry on in a timely way to receive care. If there are items that could cause harm, if those are legal, normal kinds of items, those will be checked in a locker for people. If there are legal weapons, those will be confiscated and they will not be returned.
And sorry, I want to make a clear delineation, in our Regina and Saskatoon facilities, these are at the emergency departments, and these respective facilities should make a clear delineation for what will be the case at Prince Albert Victoria and Battleford's Union Hospital. Just given the layout of those two facilities as it stands, anybody going into the hospital in those two facilities will have to go through the metal detectors, not just the emergency department. Again, just given the fact that in Prince Albert right now, we have a very significant capital project going on and everybody comes through one door. In at the Battleford's Union Hospital, it's very much the same way. Everybody comes through one single point. So it will look a little bit different in those two facilities than it does in the Regina and Saskatoon facilities.
And if I could just add as well, we did implement this process in Royal University Hospital, Jim Pattison Children's Hospital Emergency Department, which is one of our busiest emergency departments in the province. We implemented that in the fall, and so we have seen that it has been effective in terms of flow for patients, and ordered additional metal detectors in December, and we're pleased that those are now in place and being operationalized in our key emergency departments.
Will there ever be a situation where a patient would bypass that because of their injury, emergency, that sort of thing?
I mean, that's maybe more of an operational question. I mean, there is obviously the challenge of patients who arrive via EMS, and I had the opportunity to be at Prince Albert Victoria a couple weeks ago, and was touring the emergency department with the managers and some of the staff there, and they identified that as a challenge. That'll be something operational that will have to work out. I think if somebody is coming in at a high level of acuity, I don't think it's appropriate to wheel them through the metal detector, when the priority is getting them the level of care that they need as soon as possible. So there's some operational nuances there, and I think I trust the Saskatchewan Health Authority and their clinical teams on site to make those appropriate decisions as they see fit.
What's your reaction been to the weapons you've already seen coming through RUH?
So I will say, even in the first few days of operations, we have confiscated knives. We've also seen that it's had a deterrent effect as well in terms of people that may have weapons. They see the metal detection and then turn and know that they can't come into the facility. So it's a strong deterrent to individuals that are contemplating bringing weapons into our facilities.
I'll just say it's disturbing.
Yeah.
Frankly, it's disturbing. I've thought about this quite a bit. I can't think of a situation where bringing a weapon into a healthcare facility is going to improve my care experience. There's no need for these weapons to be in our healthcare facilities. Absolutely not. Not for the patient and not for the healthcare workers. There's good reason that we have these metal detectors in these facilities. These items that have been confiscated, they do not belong in healthcare facilities. They will not make your healthcare experience better, and they quite frankly put our staff at risk. And that's something that I don't find acceptable.
And in terms of the public policy review, it's something you guys are doing for the future to make some positive changes. But I'm just wondering and curious why you're not listening to maybe some of the requests from health unions or nurses unions. Have you guys been in contact with them? They told me yesterday they didn't have any consultation about the metal detectors. So I'm just wondering if you're going to implement some of their wishes in what you're doing going forward.
Maybe I'll speak first, and then Andrew, you can add if you have anything additional from the SHA's perspective. I have the opportunity to meet with our healthcare union partners on a regular basis. Safety is a topic that has come up, I think, in every single meeting I've had with them. And as I said, these concerns, this doesn't just come from one or two incidents. This is a reality that I think both patients and healthcare workers are concerned about and have been concerned about for at least several months and even before that. So there's going to be more opportunity to engage with healthcare unions. As I said, I have an opportunity to meet with them on a regular basis. I did have an opportunity to speak with Bryce Boynton, I believe it was last week, and I know him and I will be meeting soon to discuss security in facilities on behalf of his members, and I know that I'm sure I'll have an upcoming opportunity to engage with our provider unions, QP and SEIU West and SGU, as well as HSAS. So again, that engagement is ongoing. That has been going on as long as I've been had the opportunity to be in this file, and something we'll continue to work with them on. I think, obviously this is a positive step forward. There's still more work to do in terms of making sure that those members feel safe when they come to work, so they can provide top quality patient care at the end of the day.
Yeah.
I was wondering, is there any possibility like metal detectors will be added to all emergency departments in the near future?
So I would just share that we've prioritized some key areas where we know the risk is the highest. We really welcome the review of protective services, and that will definitely help inform, what is the right level of security in different facilities throughout the province. And there certainly are differences in hospitals throughout the province. There's different levels of risk. But I also want to say that metal detectors are not the only tool either. The effective deployment of protective services, cameras are another very effective means for us to support safety, but also training and support that we provide to our staff throughout the system in terms of how to de-escalate and manage difficult situations.
And I'll add to that. Andrew's right. If you have the opportunity to be in facilities of different sizes right across the province, the emergency department in Nipawin is very different than the emergency department at RUH. And that being said, staff in any facility in the province, we want to make sure that they have a safe work environment. As Andrew said, these first initial sites have been prioritized just given the volume and I think the risk factors that we've seen in terms of protective services incidents and interactions in recent months and in years gone by. But certainly, I think that's one thing that this review will look at is protective services, not just in these urban facilities, but in facilities large and small right across the province. And then again, working with the Saskatchewan Health Authority as the operating partner to figure out what's going to work operationally in facilities. And Andrew makes a great point. Metal detectors are not the only tool, but certainly I think are an important piece initially here as we step up security.
How common are these independent reviews? Has there been one into the SHA before? How common is this?
My understanding is there was a review on security back in 2018. Obviously, there'll be an opportunity to review, review the findings from that review. But I do think, the world has changed a little bit in 8 years, and so, Andrew and myself both spoke to it. The reality is the complexity of interactions and the complexity of patients coming into our facilities has changed. And so that's where I think it's time to take an updated look at that so we can really provide a refreshed view on what the SHA's role is and what we need to have in place so that patients and staff feel safe.
So both the incidents that you spoke about today, Trevor Dubois and the PA hospital, they happen to Indigenous people. So one of the things that I've seen a lot on social media is what kind of training are we hoping to provide people coming into protective service roles, and what training already exists?
Yeah, so in terms of training for our protective services officers, they do receive more than 100 hours of training. It includes training on prevention, de-escalation, training in terms of the Mental Health Act, Criminal Code, report writing, evidence review, confidentiality, also practical defense tactics, and they are fit tested and also receive dedicated de-escalation training. We also provide all of our Saskatchewan Health Authority training in terms of culturally responsive care, trauma-informed care that helps them, understand, the patients that we're caring for and what their unique needs may be. I will also say, in response to the PA incident, we were able to meet with the Prince Albert Grand Council, discuss the situation, and together came up with the idea of an Indigenous patient liaison that we will contract from Prince Albert Grand Council to just help ensure that we have a welcoming environment and to help coordinate together with our staff, including our protective services staff.
Is there any further information on the investigation into Trevor Dubois that can be shared? Do we know a cause of death yet?
So currently, there is an investigation underway both by the Saskatoon Police Service as well as the Saskatchewan Coroner Service. We're also, we've initiated a critical incident review internally with the Saskatchewan Health Authority. We're committed to providing information to the family. As the minister said, I've had the opportunity to meet with the family, also Saskatoon Tribal Council, and as information comes through those reviews, we will share information as well as any recommendations to make improvements for the future.
With these added metal detectors, is there any plan to increase the number of security personnel at hospitals as well? Because I understand it does take several security officers to operate the detectors.
Yeah, there will be a total of 51 additional protective services officers to support the process with the metal detectors. And yeah, that will be an enhanced level of security presence also within our facilities.
The unions of health workers are saying that the metal detectors are a good start, but the problem is that there is a lack of service all over the province in terms of healthcare. What are you saying to them?
A lack of what, pardon me?
A lack of services.
Protective services specifically, or?
No, the services in regarding health, so mental health services. They said that there is not enough all over the province.
Yeah, I would say to that, what we're saying today is that metal detectors, are one tool and it is a start. I think this review is going to indicate opportunities to potentially enhance security in these specific facilities, but in really facilities right across the province. I know that Minister Carr and our ministry as well are working hard to enhance mental health services and provide those services as close to home as possible. There are significant virtual options available for patients to receive mental health supports, even when they live in rural or remote communities, maybe further away from a health center. I think about in Regina at the urgent care center, having the dedicated intake and triage space for mental health and addictions concerns, the first of its kind in the country. So, obviously we work to make sure that these services are as available as possible for residents, and I tend to agree that this is a start, but we're going to need to continue to do more to make sure that patients and staff feel safe.
Do you foresee any challenges hiring those additional protective services workers and retaining them?
That's a great question. We employ nearly 300 protective services officers today. We're proud of the work that they do. We know their jobs are very difficult. We're confident that we'll be able to recruit to staff the services that are being put in place. A number of those are already live, up and running. That's some of the work ahead of us for sure, is to recruit into all those positions.
These police officers also perform random checks, especially for items that cannot be detected by metal detectors.
Well, I'll just say, we certainly work in collaboration with police in certain circumstances when we're responding to an incident in our facilities. And certainly having on-site protective services allows for an immediate response, and part of our protocol in situations that require police is also to reach out to police for their involvement and support.
And to answer that question as well, again, part of this review, one of the pieces is looking at the current state and then looking at what maybe a future state should be on how protective services, whether that be SHA employed or third party contracted by the SHA, interface with local law enforcement. We also have a variety of law enforcement agencies around the province, whether that be municipal forces in many cities, and then the RCMP, and as well as the Saskatchewan Marshal Service now providing service in a couple of communities. So, I think we need to I think that's again why, as part of the review, I want to look at where are we at now in terms of what's that interface or handoff or interaction with local law enforcement, and then what do we need that future state to be so that, for example, illegal items can be confiscated and removed from the premises. And I know I've had some conversation already with our new Minister of Community Safety, Michael Uyghur, and I expect that Minister Uyghur and myself will both be active in terms of engaging with whoever ends up doing the review. I think Minister Uyghur has some good thoughts to add on this that we've already discussed, and an opportunity again to work with our local law enforcement agencies. They want the hospitals to be safe places as well. So.
Is there also seems like that the SHA is looking into an anonymous employee reporting line? Why is this necessary, and which unions exactly were spoken to about this being implemented?
Yeah. So we were initially going out for procurement a little more than a year ago, and all of the unions were engaged with respect to that request for proposals. We did not award following that initial approach. We just at the time didn't have the proposal to fully meet what our requirements would be. We are now out for request for proposals a second time to find a provider. We're aware that other employers, certainly large employers like the Saskatchewan Health Authority, do have services like this in place. And the whole intent is to really support accountability, transparency, but to allow staff a safe way that if they have a concern about conflict of interest or harassment or a material breach in policy, that they feel safe to then bring that forward in an anonymous way so that we can investigate that and address it.
Why are you saying that they are not being spoken to now about this then?
Well, it has been some time since we initially engaged. As I mentioned, there was engagement prior to the issuance of the first request for proposals.
When I spoke to some of the unions yesterday, there did seem to be some frustration about, you know, putting in energy and effort, maybe funds, I don't know how much money this costs, to this service now when there's so many other things, you know, as mentioned, mental health, supports, even just staffing, and also that they feel they will be having to like walk on eggshells when this is implemented.
I think.
Yeah, maybe I'll make a comment to that. The healthcare system is large. We do lots of things each and every single day. Saskatchewan Health Authority is the largest employer in the province. As Andrew mentioned, large employers in the public and private sectors, it is quite common to have, and I would say typical, for there to be a way for people to bring forward concerns anonymously that can be investigated and then dealt with if found to be the case. This is not an uncommon thing in large organizations. Saskatchewan Health Authority is the largest employer. And I know that Andrew and his executive leadership team and managers right across the province, you know, are working hard to create an environment where, you know, if an employee identifies an issue, that can be brought forward through their manager and up the chain. However, there may be some employees that don't feel comfortable going to a manager with a concern or feel like there might be a conflict of interest. And so the framing of this by the opposition, I think, has been quite dismaying. You know, we want there to be a safe way for people to bring forward anonymous concerns, and so that the Saskatchewan Health Authority can investigate that and address that if needed. So I think the way it's been portrayed is unfortunate. Again, we do lots of things in the healthcare system each and every single day. To have this as an option for employees, I think is reasonable.
And Minister, I'm just wondering, you did say that you were planning on having a conversation with Mr. Dubois' family, but if you had any kind of message that you would want them to know today, what would that be?
Yeah, as I expressed earlier, I want to offer my condolences for their loved one. I had the opportunity to read several of the tributes online to Mr. Dubois, and he sounded like a very a young, very community-minded man, and so, you know, and again, offer my condolences to the family. As Andrew and I have both said, they're still waiting for information from the Coroner Service and SPS. And again, I had the opportunity to speak again with Tribal Chief Arcan last night. And, you know, I reiterated my commitment to meet with the Dubois family when we have more information so that we can have a fulsome discussion. And I meet with families and patients every week in this province, and, you know, we'll look forward to that conversation when we have more information.
I'm just wondering, are the 51 security officers that are being brought on, is that by a third party or is that SHA?
It's depending on the facility. So certainly the ones that are operational today in Saskatoon and Regina are SHA employees. There are additional sites where we have protective services officers that are contracted, and in those cases we'll be working with those firms to put that process in place.
Regarding your initial meeting with the Dubois family and Tribal Chief Arcan, what were the concerns that they discussed with you?
Well, I just want to acknowledge the deep loss that family has had. It was difficult, a very difficult situation for that family, not having all the answers to questions that they had. And when we met with them, it was really our opportunity to just say, you know, how badly we feel for the loss, and our commitment to ensure that we learn from the situation once the investigations are complete, and that we're committed to accountability. So I will just say, I personally had the opportunity to meet with the family and Saskatoon Tribal Council on the day of Mr. Dubois' death. And part of my commitment is that we continue ongoing communications with both family and Saskatoon Tribal Council.
I know there's still an investigation that's going on. Do you know what happened? Can you share what happened to the peace officer that was involved?
We did suspend the protective services officer that was involved in the incident until such time as the review and the investigations are complete. We are also doing a specific, any time that a protective services officer is using force in a situation, there's also a use of force review that is done, and we have contracted a third-party provider to assist with that as well.
I think we'll do a couple more questions and then wrap it up here.
Is the use of force with security officers something that you have seen often? Obviously, maybe not to this extent, but with maybe escalated situations that arise, how common is it to see officers in hospitals using force?
So de-escalation is always the first priority for our team members. We want to resolve situations. But as I commented earlier, we are seeing an increasing complexity and an increasing severity, and also weapons, very unsafe conditions for patients, families, staff, and physicians in our facilities. I'm thankful for timely response in certain situations that warrant that from our protective services officers. In some situations, it is appropriate that there is a use of force to ensure the safety of everyone involved. And as I mentioned earlier, we always do a review of each of those situations to say, was it appropriate? And that supports our training and development of our teams as well.
The College of Family Physicians is looking to establish a provincial patient healthcare registry. Is that something that we see that's needed in Saskatchewan?
I had the opportunity to actually meet with the College of Family Physicians earlier this week here in Saskatoon. As I do regularly, I meet with Dr. McGonigal. Certainly, we talked about that, and if the family physicians of the province, want to, engage in a discussion around patient attachment and panel size and understanding who's attached and who isn't attached, certainly we'd be interested in that discussion. As you know, it's a significant commitment of the government that everyone in Saskatchewan has access to primary care by 2028. I think there's been some really positive steps made in that regard in the last year. There's still more work to do. And there has been some work done on, both registries of providers and then thinking about how we can accurately determine attachment numbers and ensure that we're moving in a positive way to more patients being attached to primary care.
Just quickly, is there a cost associated to the metal detectors along with the 51 new protective services?
I don't have that information. 3 million? Oh, there you go. About $3 million.
So just logistics-wise with the metal detectors, when someone's going through a metal detector, and let's say they do have like a metal device, they need a wheelchair, a prosthesis, whichever it may be, how does the process change for that? Do you need to take that metal part away from them, even if it's for mobility, let's say?
Yeah, I think the process would be very similar to, going through airport security. If someone was in a wheelchair, we'll have handheld metal detection devices as well. Sometimes it's just a matter of if we've got bags or things like that we can run through the metal detection. But again, just really requiring the judgment of the team in ensuring the safety for everybody involved, but also ensuring that we've got a welcoming environment and an effective flow into the facilities.
Any sort of increase in complaints against security at this time with more incidents happening?
I don't know that I could comment on whether there's an increased number of complaints, but I would say this, certainly, we take feedback from our patients seriously and always look at situations and seek to understand, what was that patient experience and how can we enhance that experience in the future.
Do you know how many weapons have been found in the metal detectors at RUH just in the pilot project?
I don't have a number on that, but I can tell you certainly we have confiscated weapons that have come through during the pilot. And actually, even this week, in the early days of metal detection at St. Paul's Hospital, we've also confiscated weapons that would have otherwise found their way into the facility.
Is this a daily basis or a weekly basis that weapons are being brought in?
You know, I would just say this. Weapons have no place in a healthcare facility. There should never be a weapon that comes into our hospitals. And, you know, I'm excited about this enhancement to our security, a level of prevention to stop weapons from coming into our facility. So one weapon coming into our facility would be too many.
But is this semi-daily or like?
Well, you know what I expect, you know, I would say prior to having the metal detection, there's a risk that weapons could come in without our awareness. But we have had incidences where weapons were a danger to staff and patients. I believe that there will be an increased awareness by individuals that we have the metal detection in place, and I think it'll be a deterrent for us even seeing them come into the hospital. So the you know, the word will be out that we have metal detection there, and again that we're taking a stand against weapons coming into our facilities.
You can't comment on the actual frequency with which we've seen weapons since we've implemented those metal detectors?
Well, I think.
Well, keeping in mind, well, you have to keep in mind that the RUH pilot has been in place for a couple months, and then we're just in the first few days of metal detection at Saskatoon City and St. Paul. So it's probably premature to comment on the frequency at those two facilities. And again, the pilot has also been, you know, to my understanding, working with the Saskatchewan Health Authority on this, you know, trying to fine tune what, you know, what the metal detection sensitivity is on the metal detectors. So, and again, Andrew said it well. You know, regardless of the frequency, a weapon coming into a healthcare facility is just not acceptable. And so, and I know I said it earlier, but at the end of the day, bringing in a weapon is not going to improve your care experience in any way. And it's likely going to end up potentially in you having an interaction with a protective services officer. And we want you to come to our healthcare facilities and receive care. That's got to be the priority. I know that's the priority for our physicians and nurses and really the whole healthcare team. You know, hopefully we continue to track down the weapons that are attempting to come into our facility, and that this acts as a deterrent that, you know, people, if they are carrying illegal items, don't bring that into the building.
Will results of that pilot project be made publicly available?
Let Andrew speak to that.
Yeah, I would just say, you know, we haven't done a formal assessment of the pilot. It was more a situation of trying this technology out, seeing the impact that it's had. I can endeavor to see if we have some data or information in terms of the frequency in which we've detected weapons in our facilities. The primary piece, though, for us was really testing the process in terms of flow for patients and ensuring that that's ready to replicate to other facilities. And I would also maybe add, in terms of some of the earlier questions, you know, in terms of union engagement, staff engagement has also, for us, been critically important. And that has been one of the suggestions that our teams have made, is metal detection would be an additional level of protection in these higher risk facilities.
Thanks very much, everyone. The Saskatchewan Health Authority does have B-roll available of the metal detectors at both City Hospital and St. Paul. So if you email just the media email address for Sask Health Authority, we've got B-roll and photos for you.
Thank you. Thanks, everyone.
Thanks, everyone. Thank you.